Every day brings another story about the depth of this country's opioid crisis. Overdoses up, emergency services overwhelmed, another family burying a loved one.
The Centers for Disease Control and Prevention says the opioid epidemic is getting worse.
A groundbreaking new report out this morning calls substance abuse one of America's most pressing public health problems. 12.5 million Americans abused prescription painkillers in the last year.
In 2016 alone, according to data from the Center for Disease Control and Prevention, opioid-related deaths from heroin or prescription drugs accounted for 42,000 deaths, and that equates to 115 people every day in the United States who've died from an opioid-related overdose, and that could be from heroin or prescription drugs or fentanyl or another analog. Because the trends in opioid-related mortality continue, it's important to use strategies such as medication-assisted treatment, which are evidence-based and can help put people on the path to recovery. Yet at the same time, there continues to be barriers to the adoption of medication-assisted treatment. When we talk about medication-assisted treatment, we're talking about the combination of FDA-approved medications for the treatment of opioid use disorder, in combination with psychosocial services and other behavioral health needs and counseling needs that the individual may have. So it's really the combination of the pharmacological and the psychosocial aspects to treat the whole person. The medications that are used in medication-assisted treatment, so the FDA-approved medications, include methadone, buprenorphine, and naltrexone. So our project really focuses on the buprenorphine aspects. AIR is leading a grant-funded project called the Rural Oklahoma Medication-Assisted Treatment Expansion Project, which we call Oklahoma MAT. It's a grant-funded project by the Agency for Healthcare Research and Quality. AIR is partnered on this project with the Oklahoma Department of Mental Health and Substance Abuse Services, the American Society of Addiction Medicine, and the University of New Mexico Health Sciences Center, to propose a multifaceted solution that really emphasizes training and mentorship for primary care physicians, nurse practitioners, and physician assistants who are most often new to being a prescriber of buprenorphine for opioid use disorder. So our project is offering the training that's needed to obtain the waiver, which affects our primary goal, which is to expand capacity in rural areas for providers being able to treat opioid use disorder in a place where there's a real shortage of providers who are trained to do that. There are about 8.67 buprenorphine waivered providers per 100,000 population nationwide. In Oklahoma, that number drops to 6.47 waivered providers per 100,000 population, and those primarily are in urban areas. In our 42 counties of focus, we're currently seeing a rate of waivered buprenorphine providers that is 3.63 per 100,000, so about half the state rate. So there's still some stigma in the provider community, both around the modality of medication-assisted treatment and using a controlled drug, but also there's some concern about the kind of patient that might be brought into the practice. So our research has shown that a very strong grounding in the disease of addiction, understanding addiction and the nuances that go along with it, are very important to becoming a successful provider of medication-assisted treatment and treating people with opioid use disorder. And that includes not just the pharmacological needs, but also an understanding of what other connections need to be made for this patient to behavioral health services, to mental health counseling, to addiction counseling that may be non-pharmacological as well. At AIR, we're working to address the opioid epidemic on several different levels, and this includes safe prescribing practices for pain medications. It includes the expansion of treatment. We're also using data to understand what some of the particular challenges are at a community level and to help decision makers understand what those data might imply about potential solutions that maybe cross sectors and cross systems. You know, whether it's through the justice system or the treatment system or public health. As the opioid epidemic continues, people are struggling to find ways to curb the tide of the opioid epidemic. And there's many strategies that are in place to try to do that. An expanded capacity to treatment to serve the needs of people who have opioid use disorder. First of all, identify them earlier, get them into treatment faster, and keep them in treatment is really important because it can help turn the tide.